Hi everyone, and welcome to Doc's Thoughts. Today I want to talk about the big T, and that is testosterone. So testosterone is a sex hormone. It is produced in large amounts in men, smaller amounts in female. In today's Doc's Thoughts, I'm going to talk about testosterone production in men. Even if you are a young dude listening to this, I would stay tuned because how much testosterone you have when you're younger and how you support your testosterone when you're younger will affect your testosterone when you get older. And believe me, you want your testosterone levels to be nice when you're older, so stay tuned. What is testosterone important for? So all of us obviously think of the sexual effects of testosterone. We think of healthy sex drive and reproduction and erections and things like that. That's just a small piece of the puzzle. Testosterone is actually really important for things like building healthy muscle mass. It's important for moods. It's important for energy. It's important for sleep quality. It's important for so many things beyond just sexuality. So it's really important to have good, healthy testosterone levels. The other thing you might not know is that after the age of 30, testosterone levels slowly go down as you age. So men literally have a curve that looks like this with their testosterone levels. As they age, it just simply gets lower the longer they go on. I read a statistic recently that 45% of men, or no, it was 39% of men over the age of 45 actually have low testosterone levels. I've seen different statistics, but they're all about that same percentage. So it's a pretty significant amount of people who actually have low testosterone, I would say at a fairly young age. So it's important really to think about that with yourself. And then there's the good thing to know about testosterone is there's natural ways that you can actually optimize your testosterone and try to keep it as high for as long as possible. So lifestyle is key. And this is where the young people should really listen in, because the healthier you are when you're young, the more likely you are to have normal testosterone when you get older. So eating a healthy, whole foods, unprocessed diet without lots of fast food, without lots of sugar, plenty of water is really, really important for maintaining healthy testosterone levels as you get older. Exercise is really important. That seems like a no-brainer, but weight training, cardio, especially weight training, those are very, very important things to add into your life to maintain healthy testosterone levels. I would say weight training at least 2 times a week, up to 3 times a week would be ideal. Sleeping well is really important. So disruption of sleep leads to really a lot of downstream factors that can affect your testosterone levels. So getting a healthy amount of sleep is critical. 7 to 9 hours a night is what we need. Historically, we as Americans are terrible sleepers, so it's really, really important to think about how many hours of good quality, not broken sleep, good quality sleep you're getting, and then try to fix it if you're not getting that goal. Stress reduction is important, so making sure that not only do you reduce the stress as much as possible in your external life, but really just working on how you respond to stress. There's so many things we can do about that, and I've talked about that in my other Doc's Thoughts plenty, so I'm not going to belabor that too much. And then avoiding toxins. So things like marijuana use, excessive alcohol use, and other toxins can actually really affect your testosterone levels. Chronic opioid use has been found to directly lower your testosterone levels. So you want to think about what toxins you're putting in your body and how they might affect your testosterone or other hormone production. And again, you guys know it's not about being perfect. It's just about maximizing and optimizing as much as possible while also having a really fun life. You know I love to have fun. So what does low testosterone cause? In my older men, and when I say older, I mean like over 45, so you don't have to be that old, but it can cause obviously lower libido, erection issues, fatigue, brain fog, mood changes, and irritability. A lot of my guys with low T will just be kind of like, I'm just really snappy and irritable. It can cause lack of drive. So testosterone is very much a drive hormone, so it makes men want to get stuff done. When their testosterone levels are done, they literally will say to me, like, I just don't even feel like doing my work. I don't feel like hanging out with my kids. They just feel kind of funky, and you optimize their testosterone levels and all of that goes away. So it's really, really important for some really critical parts of having a healthy, vibrant life. And then beyond lifestyle, what are some of the things we can do to boost your testosterone levels? So I would say, first of all, you want to make sure you get your levels checked. You just don't want to go blindly into putting yourself on testosterone. Obviously, there are people who order it online, which is absolutely crazy. So you want to get your levels checked. Second of all, you want to work with a legit practitioner. There are tons of online places where you can get testosterone delivered to your house. You want to work with someone who's looking at all of your hormone levels. Testosterone converts into estrogen. Testosterone converts into DHT, which can cause hair loss. So too much of a good thing is never a good thing. And you want to make sure you're working with someone that isn't going to make you sicker with their therapy, right? So you want to make sure you're working with someone who looks at the whole panel. And then when it comes to replacing testosterone, you can do it with shots that you take either weekly or every 2 weeks or somewhere in between. You can use creams and gels, which some men really hate shots and they do well in the creams and gels. I'm not a big fan of those. They're kind of messy and kind of a pain in the butt, but I do have some men who use that. And then you can do pellet therapy. Pellets are little testosterone pellets that get kind of surgically implanted in the fatty tissue of your butt every 6 months. So you come into the office, like my office, we numb you up, we put the pellets in, and then your testosterone is good to go for about 6.5 months, and you don't have to think about it. That's probably the optimum way to get testosterone, but obviously for some, it's a big expense. It's going in every 6 months, so it's a lot to commit to, but it's probably the most effective way to replace your testosterone levels. And then you also have to think about the supplements you're taking. So things like zinc can help boost your testosterone levels. You want to make sure you're on a good multivitamin, your B levels are optimized, all these different things that it's not just one thing. It's never just one thing. You have to look at the whole picture to achieve really good hormone balance and optimization. So with that being said, let me know if you have any questions or comments about testosterone therapy. I hope this was helpful for you guys, specifically you guys. Also, females, realize that you want to have healthy testosterone levels as well. And you can actually replace your testosterone as well on a much smaller scale and get some of the healthy benefits that men also get. And with that being said, thanks as always for listening, and I'll talk to you guys soon.